What's my spine got to do with my neuropathy? If you've been living with burning, tingling, or numbness of peripheral neuropathy, you've probably never once thought about your spine. Why would you? Neuropathy shows up in your feet. The spine is nowhere close to your feet. It seems like the two completely different problems. But here's the truth. Almost nobody explains to you. Your spine and your nervous system are not two separate things. Your spinal cord is the main highway that every single nerve signal in your body travels on. And when that highway is congested, inflamed, or under pressure, the nerves branching off of it, including the ones running all the way down to your toes, pay the price. The nervous system is one connected system. Think of your spinal cord like the trunk of a tree. The nerves that reach your hands and feet are the branches. If something is wrong at the trunk, degeneration, misalignment, inflammation, reduced blood flow, it doesn't just stay at the trunk. It travels outward, weakening everything downstream. This is why so many neuropathy patients also have a neck or lower back issue that they never connected to their foot pain. The spine isn't the only cause of neuropathy, but it's very often a contributing factor that gets completely ignored because most doctors are only looking at the nerve endings in your feet, not at the system that feeds them. Why gabapentin and Lyrica don't fix anything? When you're in pain, of course, you want relief. That's completely reasonable. But here's what your prescribing doctor probably didn't explain. Drugs like gabapentin and Lyrica were never designed to heal a damaged nerve. They were designed to quiet the pain signal traveling to your brain. That's it. That's the whole job of the drug. It's a bit like disconnecting the smoke detector because the beeping sound is annoying, while the fire keeps burning in the wall. You'll feel better for a while. Meanwhile, the actual nerve damage, the reduced blood flow, the lack of oxygen, the missing nutrients, continues unaddressed, often getting worse. That's why so many people tell me that their dosage keeps climbing over the years. The medication was never treating the cause. It was only muting the system. The three real keys to real nerve improvement. If numbing the signal isn't the answer, what is? After years of working with neuropathy patients, I found that real improvement almost always comes down to three things. Damaged nerves need to heal all three, not just one. Number one is oxygen delivery. Nerves are incredibly oxygen-hungry tissues. When circulation to the small vessels feeding your peripheral nerves is compromised, which is extremely common with diabetes, autoimmune conditions, and even long-term inflammation. The nerve is essentially suffocating in slow motion. Without adequate oxygen, healing simply cannot happen, no matter what pill that you take. Stimulation of the nerves. Nerves that aren't being used properly and aren't receiving the right signals from the spine and the brain start to weaken and misfire. Just like a muscle that atrophies without use, understimulated nerves lose their function over time. The right kind of targeted stimulation can help wake up these nerves that are still alive but struggling to communicate. Nutrient delivery. Nerves require specific building blocks, B vitamins, healthy fats, and key micronutrients to repair the protective coating and function correctly. If these nutrients aren't getting where they need to go, either because of diet, absorption, or poor circulation, the nerve has no raw materials to rebuild itself with. When oxygen, stimulation, and nutrients are all addressed together, the body has what it actually needs to begin repairing the nerve function, not just numbing the symptom. And I want to know, tell me what kind of symptoms that you're having in the comments section below. Finding your root cause. This is where functional neurology comes in. Instead of asking what drug reduces this symptom, we ask a very different question. Why is this nerve struggling in the first place? That means looking at how your nervous system, spine, circulation, and metabolic health are all working together or not working together. For some patients, it's largely a circulation and metabolic issue. For others, spinal involvement is playing a much bigger role than everyone told them. Most of the time, it's a combination. Your feet are not lying to you. They're sending you a message from further up the chain. The question is whether you keep muting that message with medication or finally start listening to what's actually they're trying to tell you. If you've been told that there's nothing more that you can do beyond managing the pain, I encourage you to get a second opinion, one that actually looks at the root cause instead of just the symptom. I have a free neuropathy assessment tool. It only takes 2 minutes to complete, and it finds out how bad your neuropathy is right now. You'll have the results instantly sent to you along with the recommended action plan. The link to the neuropathy assessment is in the description below. If you like this video and want to check out others like it, click on the video that appears above. Thank you for watching the video, What's My Spine Got to Do with My Neuropathy?